All right, welcome everybody. As Bridget said, my name is Nicole Summers and I am the administrator over at our Sunset Hills campus for assisted living and memory care. I have been with Friendship Village for 11 years. I started off as their sales and marketing director, and then in 2017 got my administrator's license and took the helm and started my administrator journey. So we are going to talk about assisted living, all things assisted living. So if you have questions as we go, we have a small crowd here, so go ahead and ask your questions and we'll answer them to the best of our ability. So as I was putting together this slide, I wanted to share some numbers with you because since I have been in the assisted living world for 11 years, I have seen the landscape of assisted living change. About 70% of residents have memory impairments, and I've seen that as we've moved in residents throughout the 11 years. It seems like there is some form of memory impairment, whether it's just early onset, aging forgetfulness to full-on dementia. That is one of the reasons why we are expanding our memory care, and so we're starting that expansion in Sunset Hills right now. The reasons for the growth for the numbers that you see on the screen and why we need more assisted living is the baby boomers. They're currently 59 to 78 years old, and they represent about 21% of the population. So according to the research from the National Investment Center for Senior Housing and Care, the U.S. aging population is going to create an increased demand for assisted living. The United States, is going to need about 156,000 assisted living communities. Right now, we have about 30,000. So we see that demand there, hence why we want to expand our services. Okay, so let's just get into the nitty-gritty. What is assisted living? I like to describe it as the best of both worlds because the residents that move in still have their own private apartment, their own belongings, but they have the assistance that we provide for their daily living, 24/7. So the first bullet point that you see on the screen, 24-hour licensed nursing oversight, you do not see that in all assisted living communities. We often will have other communities that tour our communities, and we note that, and they're like, wow, you guys are really lucky that you have nurses in the building 24/7. By the state regulations, we do not need a licensed nurse in the building every day, but we at Friendship Village have a high standard, and we want to make sure that we're meeting those needs of our residents. So usually all of the things that are listed there, and I'm not going to go through each one of them, but you can see that we provide a lot of services on a daily basis for our residents. Something else that I always like to point out is there are communities out there that have a lower room and board monthly rate, but they have tiered pricing. So most communities are pretty much all inclusive. So you have one monthly rate that you pay, and if you have a few extras, they talk that through with you. Like if you need personal laundry done, that's an extra charge in some communities. If they have an incontinence program, that would be an extra charge. But all of these services on the screen are usually included in your monthly rate, and it's all inclusive. So when you're paying the bills every month, what you have going out, okay? Some communities that have a lower room and board rate, they also have what they call tiered pricing. So depending on those services, medication management, diabetes, if I have wounds that need treated, if I need help getting in and out of the shower or on and off the toilet, in and out of bed, they have fees for those services. And so you pay your monthly rate, which is typically lower, And then they add on these prices for the services that you need. And then you have all of that. And it can fluctuate. So let's say I am not feeling well and I have a fall and I go to the hospital and I come back and I need more assistance than I needed when I left. For a short amount of time, depending on what I had going on, your rates might go up and down. So that's why, the all-inclusive pricing is really helpful, because you know what you have, going out every month. And whether you need it or not, you know that you're going to get all of the services in assisted living that we can provide. Okay, our licensure, we are licensed by the state of Missouri. We do have an assisted living, a AL1 and an AL2. The difference between AL1 and AL2 is how we get residents to an area of safety if there's an emergency. The assisted living 2 communities, which is what Friendship Village is, we are able to provide more than minimal assistance for your loved one to get to an area of safety. So we are allowed to give them 3 verbal cues and 1 physical assist to get them to that area of refuge. And the AL1 communities, residents have to be able to make that pathway to safety on their own. So that's the big difference between the 2 licensures. Both licensed by the state of Missouri, so the Department of Health and Senior Services visit the communities annually and inspect everything. So they look at our life safety, our pathway to safety, which I just explained. They go into the kitchen, check our food safety, how we serve meals, are we temping the food out properly? They look at our infection control procedures. As Bridget just explained, COVID, that increased what they look at after COVID occurred. And then our plans of care. So our care plans are individualized, so depending on what they do for me might not be the same thing that they do for my neighbor, but we have to make sure that we are documenting everything that we do for a resident, and that's what they look at. And then making sure that we have wellness and socialization programming for the residents to attend to, making sure all facets are met. The care is directed by your primary care physician. So whether you choose to send your loved one to the physician that they have seen for years, take them to the office for their visits, or not, they can be seen by our medical director if it's cumbersome for them to go out to the doctor's office. So your physician will direct us with all the medications, labs, therapy, anything involving care is directed from the physician. We just follow out the service. Okay. So services that aren't included in the monthly fee are things that we would bill to insurance. So if you go to the doctor or you see our medical director, they will bill the insurance. So you'll have your co-pays with that, any lab services, home health services. Hospice is usually billed through Medicare. Therapy, whether it's PT, OT, or speech therapy. And then we do have podiatry services that come into the building. That's through Medicare as well. Of course, medications. Most communities contract with pharmacies that package the medications per our regulations, which is usually unit dosed or bubble packs, and that is just for infection control and efficiency with the medications. So that would be their regular copay through their pharmacy benefits. And then any kind of durable medical equipment would just get billed to Medicare B as well. And like I said, personal laundry, incontinence care programs, if that's needed, then that would be an extra fee. So like I said, we're licensed by the state of Missouri, and we have to make sure that residents meet requirements to live in an assisted living community. So the items on the screen are things that we cannot get around. These are things that are on their assessment list, and we have to make sure that Residents are free from tuberculosis, any communicable diseases. They have to be in insufficient health, but they don't require skilled care. So they need some form of assistance with their care on a daily basis. No chemical or physical restraints, thank God. We have moved away from that over the years, and that is not a thing. It's not allowed anywhere. Talked about the pathway to safety. They have to be able to meet that pathway to safety. And I have the last bullet point, transferring independently, asterisk, because although we can provide transfer assistance under our regulations, we'd like to see people move in able to transfer independently, and as they decline or need that assistance, we're able to provide it. Okay. But if somebody, needs help, one person to help them get out of bed. For example, we've had Parkinson's residents, and they just really needed that help getting up, and then they're ready to go for the rest of the day. We can obviously do that. We are always assessing residents, but per the regulations, we have to, on paper, assess residents every 6 months or with any change in condition. So if I were to all of a sudden be more confused than I typically am, then the nurse would go in and do an assessment, call the doctor, see what we need to do. Is it, possibly do we need to get a urine analysis done? Do we have a UTI going on? Is this just normal progression of my dementia? We have all these things that we check and then go from there. So it's an ongoing assessment every day for our residents, but we do technically have to assess residents every 6 months. All right, so the big question always is, when is it time? When do I start thinking about talking with mom or dad about moving to assisted living? The rule of thumb is always sooner than later. There has been many, many times where we have had folks on the wait list for quite a while, and then a sentinel event occurs and they have to move and there's no room at the inn, or they don't qualify and they have to go straight into long-term care. And a good example that I have experienced why I feel that sooner is better than later is because when I first started in my role as Megan, as the sales counselor, I had residents that lived, they made the choice to move to assisted living, and they have lived in the building for 10, 11 years. That typically doesn't happen. And so they have improved their quality of life by living in a community where they're getting that assistance on a daily basis. They're not struggling in their home any longer. The family dynamics were as such that the adult children couldn't care for them on a daily basis. So they made the decision. And 10, 11 years in assisted living is awesome. The average length of stay is generally 22 months. So sooner than later. It's a hard decision to help someone make that decision to leave their home that they've probably lived in for years, and all of their independence is slowly dwindling away, and those are tough conversations. It's a complex conversation, emotionally, financially, it's tough. We see that is why some people want to keep mom and dad at home because of finances. So I want to talk about some of the signs to watch out for. If you're seeing them now, it's probably a good time to at least start your research and be prepared if something does happen. At least you have gone out and toured communities and know the ones that you want to cross off the list. No way, Jose, mom and dad are not living there at all. Are they struggling with the skills needed to live independently? Dressing, cooking, shopping, laundry. Are they taking their medications the right way? So on and so forth. How's their current health? So progressive problems such as COPD, diabetes, congestive heart failure, dementia, just to name a few. That can result in your loved one needing more assistance sooner rather than later. How is their environment set up? Are there stairs? Are there fall risks in the home? Do they have too much furniture? Are there area rugs that they're going to be tripping over? Are items placed too high? Are items placed too low in the home? Are they showering on a regular basis? Wearing the same clothes for days? Now, I will say we have residents that wear the same clothes a couple of days in a row because I'm not doing anything. I'm not getting dirty. I don't sweat. I can wear this. They're, from the Depression, conserve. We get it, but we do have to have those hard conversations sometimes with them like, I understand that, but let's just go you'll feel much better. So sometimes we struggle with the same conversations that you guys struggle with too. Isolation. Are they isolating themselves? Are they getting the chores done that they normally have gotten done without a problem? Is the yard overgrown? Is the laundry getting done? Are you all doing all of that? Are they preparing nutritional meals any longer? God forbid, did they accidentally heat a pan up too hot and it smoked and the fire alarms were going off and you're getting the call, I don't know what's going on, the fire alarm's going off. Did they take out the garbage? And when they took out the garbage, they fell down and laid on the ground for hours before the neighbor noticed them. These are all cases that I have heard and why people have moved into our communities. Are the bills getting paid? Are they still driving? Have they had accidents? Do you see dings and dents in the car that you didn't see last week when you are going to visit? Are they not going out and participating in their hobbies? Are their social circles shrinking? So these are all things. It's a lot of things that we all have to think about. Okay. And then we get into the whole dementia, memory impairment piece of things. Are they wandering? Do they have good judgment skills? When I was in the sales role, we had a lady that, left the house, wandered down to the grocery store. She did it on a daily basis. They knew her, but she was doing odd things, and the people in the grocery store alerted the family, and so they're like, yeah, this is not her usual routine. Something's going on. That sparked the family to start touring and figuring out where mom is going to live. Okay, so let's talk a little bit about memory care and assisted living. So it's all of the assisted living services, there's just more oversight, and in memory care, the environment is set up for a person with dementia. Unfortunately, like we talked about 70% of assisted living residents, if not more, have some degree of memory impairment. And it can be anywhere, like I said, from normal aging, forgetfulness, to dementia. As residents age, their dementia progresses, and they require and benefit from a more, I don't want to say secured, but a more, an environment that is more created for them to live as independent as possible. So we have adapted the memory care, the Montessori-inspired lifestyle approach to dementia care. So what we do is we set up the environment, and we learn about the resident and what they did for a living, what their life story is, and how they can contribute back to their environment, their community. So we assess them. It's a little bit more than a regular assessment to move into assisted living. But we do a vision, a strengths assessment, and we ask them, what is it that you would like to do for your community, for your environment? And they help anywhere from setting the table, filling salt and pepper shakers. They have a purpose. And so when they have that purpose, when they wake up in the morning, they thrive better, they engage with residents, they engage with the staff much better, and there's more of a teamwork environment with the staff and the resident. So there's a higher staff to resident ratio in memory care, so the staff are there to guide them throughout their day. All right, so these are a couple of pictures, some visuals of how we set up the memory care neighborhood, but you can see that they are contributing to the day-to-days. When we adopted this approach and we opened memory care back in 2020, and we gathered all the residents around and told them, like, what jobs would you like to do for your community, for your neighborhood? And a few of them are like, ready to go. And then some of them are like, I'm retired. I am not doing any jobs. So we now call it the volunteer board. So here's an example of our volunteer giving board. It's a little bit more welcoming for them to contribute, but when we assess the resident and then we learn their life story, talk with the families, they now will say, okay, well, Gladys loves to bake, and so she's going to be our baking assistant. I know that Gladys also helps out a lot with preparing the salads and the fruit salads for lunch. So they actually will prepare salads for the lunch, and that's what they eat for lunch. Our nursing director had a bit of a problem with that because she was like, you're going to give them knives? They're like, yes. So we're going to go on their strengths. We do an assessment on their strengths. And if they are able to still use a knife or a peeler, whatever the utensil is, then we're going to let them do that. They're being overseen. They have guidance, and it's not like we're just giving them a knife and we're leaving the room and have at it. It's all supervised and monitored. And they feel so great after they have prepared a salad for the entire neighborhood. All right, so benefits of assisted living. You get the nursing oversight, all of the life enrichment activities, 3 balanced meals, a sense of community, memory care, the programming is outstanding, housekeeping, laundry. All of these services are there for your loved one. And it takes a lot off of your plate if you are the ones that are the caregivers now, and it takes a lot off of their plate. Just having, sometimes when the residents are in an area that is too overwhelming with them, they just shut down. And when they move to an environment where they have that support, and camaraderie with other residents that are just like them, then they start to thrive and come out of their shell a lot more. All right, so how do we have the conversation with our loved ones when you're thinking, I'm pretty sure it's time to move to assisted living or memory care? My suggestion or recommendation is just to be honest. And I know you know your loved ones better than anyone else. Sometimes being honest is, you're going to hit a brick wall with that person. But if you try to involve them as much as possible, have them be a part of that touring process, the research process. If they have questions and you don't know the answers, then when you're touring, have them sit down with a sales counselor too. I know Megan, Julianne, that's here in Chesterfield, they are very wealth of information, and they will sit down and answer questions as long as they need to. So you guys are as informed and maybe help bridge that gap with that conversation. Sometimes if they hear it from an outside person, it's a little better, and sometimes you might not be able to even get them in the car to even go tour communities. In that case, you guys go out and do your homework and then narrow it down so it's not so overwhelming. Because if you're going to take mom or dad out to look at absolutely every building, they are going to shut down even more than they already are. So I always say narrow it down to 2 or 3 buildings and then say, okay, we're going to go and have lunch. Let's just check it out. It's harmless. We're just going to go have lunch and start from there. Get your primary care physician involved. Let them be the bad cop. Let them, if they've, have a good relationship with the doc, then give them a call prior to the appointment. Say, look, we have to move mom or dad. Can you help us out with this journey? And have a conversation with them when we bring them in for the appointment. If you have multiple siblings, it's maybe you say, okay, you're going to do the legwork and go tour buildings. You're going to make sure what the finances are going to be looking like. You're going to coordinate the move. It's very overwhelming. So if you have the support of siblings to help you out, that helps as well. If not, if you're an only child and you need the help, then again, your sales counselors in those buildings have resources that will benefit you guys as well. Okay, we kind of talked about what sets us apart here and there already. Our memory care program, I think, sets us apart from many communities in the area. Long tenured staff. I have caregivers that have worked in my building for close to 25 years. That really is unheard of. The Montessori-inspired lifestyle approach to dementia care. We do have a full-time memory care life enrichment director and specialist at both buildings. And it's not about just activities in the building. We go, like Bridget said, to the butterfly house. They go out to eat constantly. They go to movies. They go to museums. I mean, we do a lot of things. Sometimes we just do scenic drives, but we'll have guided tours. In fact, the residents today went to the hill and had a guided tour. Yeah. So lots of things for the residents to do outside of the building as well. I always want to talk about the licensed nurse 24/7 as well. And 3 levels of care within assisted living. So we talked about traditional assisted living and memory care, but we do have a 3rd level of care in our communities at least. And we call it the bridge, just because it kind of bridges over traditional assisted living to memory care. So it's that resident that needs more oversight than traditional assisted living, but not full-on memory care yet. So we kind of have 3 levels of care in the buildings. And then, of course, our skilled nursing and rehab buildings that we have on both campuses. Also want to point out, we talked about this a little bit, but our board is local. So most of your communities out there are chain communities. They're at a corporate level. They're out of touch, and we are fortunate to be led by a board of directors that are local. We don't have to jump through a lot of hoops to get things accomplished on our campuses, and our leadership teams are in our buildings every day. So that kind of wraps it up with what assisted living is, when we think that you should move to assisted living. Anybody have any other questions that we didn't talk about, or any slides that I got a little bit too carried away with?